Hey, deep divers. It's awesome you're into learning and development, always pushing to grow. Like, today we're taking a deep dive into this super interesting case study about teaching experienced professionals, those who've been there and done that, something totally new. Imagine, like, you're a doctor, right? You've been practicing for decades, seen everything, taught the newbies a thing or two, then boom, someone's like, here's this fancy ultrasound thingamagic, go learn it. It's like kind of we're digging into this paper, Teaching Old Dogs New Tricks, which, gotta say, brilliant title. It's about medical faculty, those seasoned pros, learning to use Point of Care Ultrasound, or POCUS for short. So get this, we're going to break down how to teach experienced professionals, especially the ones who are used to being the experts, how to jump back into the student role.
Totally. And it's interesting. We talk a lot about training new folks, but teaching those with tons of experience already, well, that has its own unique opportunities and challenges. It's not like these doctors are starting from scratch.
Right. And this paper, it highlights how senior faculty, they're used to being the experts, asking them to become students again, embrace this new tech. That needs a special touch.
That's where adult learning principles come in. These senior faculty, they're self-motivated, right? Lifelong learners, but there might be a little hesitation, yeah. No one loves feeling like they're back in med school, fumbling with something new in front of everyone. That's where psychological safety is so crucial.
It's giving them the space to not just learn the what, but to dig into the why. Yeah. They're not just going through the motions, they're using their years of experience to really get how this new tool fits into what they already know.
Yeah.
And speaking of how, the MGH program used this really cool approach. They called it the bolus and drip method. Catchy, right?
Very catchy. So the bolus was intense, hands-on, a one-day workshop. Like that initial flood of information and experience, they covered using POCUS for the heart, lungs, you name it.
And they didn't just talk about it.
Yeah.
The faculty actually got to use the ultrasound equipment right there, which the paper really emphasizes as key for these senior docs who learn best by doing.
Absolutely. It's putting that knowledge to use immediately that really makes it stick. But the learning didn't stop there. That's where the drip part comes in ongoing training and practice to reinforce everything from the bolus.
And it gets even more tailored. They picked a small group to be super users. They got extra training, worked directly with a POCUS expert, basically became the go-to gurus for the program.
Smart move. They're building expertise from within. These super users become mentors, resources. It just adds to that whole environment of learning and support.
And get this, the paper mentions how the senior faculty were asking why a lot more than, say, the junior learners. At first, you might think, oh, are they being difficult? But actually, it's the opposite.
It shows how much experience they have. They're not just taking things at face value. They want to understand the why, the reasoning behind it all. They've spent years, right, honing their skills. So, of course, they're going to bring that same critical thinking here.
It's like they're saying, hey, we're not using this just because you said so. We need to know how it all fits into how we treat our patient. Have you ever felt that way? When you're learning something new, you just got to know why it matters.
All the time. And honestly, that's huge for anyone, no matter what you do. You'll learn way better if you're asking why it works, not just how. Those why questions, that's engagement right there.
And the paper even suggests that this whole needing to know why thing, it could be super important for preventing burnout, especially in experienced professionals.
Good time. Learning new stuff, especially in a field like medicine where it's go, 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 it can really help with that emotional exhaustion.
Like hitting a reset button, right?
Yeah.
Suddenly, new tool, new perspective, and bam, they're re-energized.
Right.
Even outside of medicine, I think we've all felt that spark when something new just clicks.
Exactly. And it's not just some feeling. Studies show doctors who keep learning, whether it's POCUS or just staying updated, they're happier at work.
Which equals better care for everyone. Win-win. So it's not about just teaching them some new trick. It's about realizing that giving them new tools, it helps everyone. And speaking of recognizing experience, let's get back to those why questions. What do they tell us about making learning actually work, especially for these experienced folks?
Totally. The MGH program got it. They knew these senior faculty weren't just blank slates, right? They needed to feel heard, that their experience actually mattered.
Which brings us back to psychological safety. They created this space where it was okay to not know everything, to try things out, even mess up sometimes.
Exactly. Asking why wasn't stepping on toes. It was them becoming experts with this new tool.
And that's huge for any learning. Doctor, new to your career, whatever, feeling safe to ask questions, that's how you really learn.
Couldn't agree more. So, zooming out for a sec, what are the big takeaways from this POCUS program? What can we take from this and use it for other learning stuff, even outside of medicine?
Great question. And it gets to why this paper is so cool. It's not just ultrasound. It's about making learning work for those who've already got tons of experience. And they nailed some universal things,
For
right?
sure. Number one, you got to recognize that senior learners, they have unique needs, different motivations. They're not starting from zero. They're coming in with knowledge, experience, even some opinions already formed.
And it's about tapping into that, using what they already know as a foundation.
Exactly. And that means getting their learning style. For a lot of experienced folks, it's hands-on, using what they learn right away and knowing that why.
Which is why that bolus and drip thing worked so well, hit all the right notes. But it wasn't just the structure, it was the whole vibe.
Absolutely. Psychological safety was key. They made it okay to ask, to stumble, to learn from each other.
And they made sure everyone knew this POCUS thing, it was relevant to their work, for patients and for them.
Exactly. They tapped into what makes people want to learn, to grow, to feel like they're making a real difference.
It's funny, right? We started talking old dogs, new tricks, and now we see it's not about age or how new something is. It's about being curious, respectful, and truly believing that learning can change things.
Well said. It reminds us that learning never stops. It's not just about work. It's about growing as a person, finding your purpose. And that brings us back to you, listening right now.
What about you? What's that new trick you've been wanting to learn? You know, that skill, that area you've been thinking about, but maybe, just maybe, you've been putting it off.
Maybe this deep dive, it sparked something, giving you some ideas, because honestly, it's never too late to be a beginner.
And sometimes it's the people with the most experience who get the most out of being a beginner again.
Remember those doctors? They wanted to know why, to really dig in, to connect it all back to what they already knew. That's what made them learn.
They weren't afraid to say, I don't know, but I want to. And look, they didn't just learn a new skill, they got excited about their work again.
So what about you? What's one small step right now that you can take to start learning?
Maybe it's that online course you've been thinking about. Or finally opening that language learning app. Or maybe it's about bringing that why into what you're already doing.
Exactly, new thing. Or finding something hidden in what you already do. The important thing is to be curious, be ready to learn.
This has been quite the deep dive. Until next time, stay curious and keep those learning caps on tight.